Hi, I'm Carrie Went, a therapist at Mindset Family Therapy.
Hi, I'm Eric, a therapist at Mindset Family Therapy.
Hi, I'm John Case, a therapist at Mindset Family Therapy.
Hi, I'm Annabella Hagen, the clinical director at Mindset Family Therapy.
Our office is located at Jamestown Square in Provo, less than 2.5 miles away from BYU.
We aim to help sufferers, loved ones, and faith leaders recognize their struggles are a mental health condition, not a faith challenge.
I tend to start working with people in the age range of about 11 to 12 years old, and then my oldest client is 84.
The populations that I serve are children, adolescents, adults. I work with couples, and I do family therapy as well.
I mainly work with teenagers and adults, and sometimes work with families.
I serve all ages, and my favorite population is working with teenagers that are getting ready to go on a mission or have come back early because of their scrupulosity OCD. I also have served with children and have supervised therapists working with children.
So alongside treating OCD, I also treat a lot of anxiety-related disorders, such as skin picking or excoriation, hair pulling or trichotillomania. I also treat eating disorders, which can also be anxiety-related. I also treat psychosis and trauma. I do some couples work and family therapy as well. I treat ARFID, or avoidant and restrictive food intake disorder, depression as well.
So the population that I typically work with is definitely the mainstream OCD population, but also OC-related conditions like body dysmorphic disorder, body-focused repetitive behaviors like trichotillomania or excoriation, and even some anorexia and other eating disorders too.
Some of the different things that I treat include OCD, anxiety. I also have extensive experience working with autism and neurodiverse clients. I also have experience working with compulsive sexuality and unwanted pornography use.
For the past 24 years, I have worked with different challenges such as depression, suicidality, trauma, OC-related disorders, anxiety disorders, and currently my passion is working with scrupulosity, OCD, and other OC-related disorders.
I find that I really like treating OCD because clients with OCD tend to be very motivated and the work is really rewarding.
So I really like treating OCD because there is such a variety of concerns that you really have no idea what you're going to get. It's just fun to see the different types of OCD that you can work with and how it manifests differently for everybody.
I worked with OCD clients that had OCD and autism in the past and found that they were some of the hardest clients to work with, and that intrigued me to get better training and understanding of OCD. And so why I like working with OCD, at first I didn't think that was the population I wanted to work with predominantly, but I found that the treatment is effective and it's enjoyable to administer, and I just love my OCD clients. They're usually very motivated, and I find the condition to be very fascinating and enjoyable.
So there's a long story, but I'm going to share a short story. The reason I became interested in treating scrupulosity, OCD, and OCD in general is because of my son. Because we went around the whole state and nobody could treat him well. So after his treatment, I decided to get trained by the Behavioral Therapy Training Institute at the International OCD Foundation, and I started getting really busy, so I needed to hire somebody, and then she was busy, and so we kept growing. And again, it is important to me to be able to provide the right services for clients that need the right therapy, not only for OCD but for other challenges. So I am passionate about Mindset Family Therapy because I love helping our community.
I've had a lot of opportunities for growth at Mindset Family Therapy because Mindset Family Therapy puts an emphasis on professional development through conferences and trainings, and even some outreach too.
Working at Mindset has provided me with many great opportunities, both to network within the OCD treatment community, at conferences, and just individualized training and experience working with the OCD population. It's been an incredible opportunity.
So I started at Mindset in 2022 when I graduated from the BYU MSW program. Woo-hoo, go BYU! And so I've done a lot of growth and learning here at Mindset. This is where I had my supervision for the last 2 years, and I did finally get my license, so yay! And there's so many trainings that you can be a part of here. I love that we go to the IOCDF annual conference. We participate in the online and in person, which is just a wealth of information there. The lunch and learns are really exciting. You can learn a ton of new information just from all of us here at the office. And supervision just has been really helpful for me. I learned a ton about how to use acceptance and commitment therapy, and since then have used that quite a bit in the work that I do with my clients.
I graduated from BYU in 2016.
You say like, rah, 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 rah.
No, not able to do that.
Go Cougs.
I am a BYU graduate, BYU MSW.
I am a BYU graduate.
Advocate to promote mental health awareness, specifically scrupulosity OCD.
Participate in online activities to increase awareness to sufferers, loved ones, and faith leaders.
Participate in presentations to treatment providers in the community to recognize this complex mental health condition.
Participate in 2 free online support groups, OCD support group for members of the church across the country and world at once a month, and Scrupulosity OCD support group for members of any faith denomination across the country and the world twice a month. We are looking for students who are curious, passionate about learning, and willing to get out of their comfort zone so as to grow and become competent and trusted clinical social workers. They must have energy and zest for life and the work they do with the people they serve. Acceptance and Commitment Therapy, or ACT, Cognitive Behavioral Therapy, CBT,
Dialectical behavior therapy, DBT, trauma-focused cognitive behavioral therapy,
ERP, exposure and response prevention, mindfulness training,
Social thinking, attachment theory,
Solution-Focused Motivational Interviewing,
trust-based relational intervention, TBRI, narrative therapy.
ICBT, inference-based cognitive behavioral therapy, expressive arts therapy,
play therapy and Santry therapy,
and Parent Coaching.
Clinic hours are from 8 to 7 p.m. We need like a little thing. Take 2. Clinic hours are from 8 a.m. to 7 p.m. and students can choose to operate within that time frame.
The hourly wage for the internship is $25 per client hour per client paid monthly.
Students will meet with their supervisor for 1 hour every week. Student and supervisor will staff clients and provide information, theory, and skills depending on cases presented. Staff meetings are twice a month and are opportunities to staff cases. That means that if you are struggling with a client, you'll be able to talk to your supervisor about the challenge that you're having, and the supervisor will be able to tell you how to go about it depending on the situation and the case and the theory that you are applying to this case.
Lunch and learn once a month with all therapists and access to the ACBS, Association for Contextual Behavioral Science website to gain a wealth of information. Protocols, journals, videos, clinical resources, publications on ACT, relational frame theory, and contextual behavioral science.
At Mindset Family Therapy, we're not only client-centered, but we also focus on our therapists to be able to have the experience that they want, the clients that they want. So I believe that we are not only client-friendly, but also therapist-friendly.
I think that Mindset, first of all, has a really beautiful office. We have a great view, and I've just loved working here. I think that you'll love it too.
I might do a blooper reel at the end.
I think that would be
I
fun.
think it'd be fun.
Because
And-
we're not perfect.
Yeah.
Uh-huh.
So we're looking into the camera and I'll just hold it right
Gotta
there.
keep it straight.
Am I still not, see, am I good?
Yeah, you're good.
So this is live,
Mm-hmm.
but I don't see
We're
a red
rolling.
dot.
It's because it's...
I think we should have just paid hired day doctors
Yes.
that look roughly like us. They come here and they're like, you don't look like your video. What are you talking about?
Hi, I'm Eric, a therapist at Mindset Family.
Okay, well, you...
Hi.
I think I'm gonna have a bloopers reel.
Yeah.
I really think because everyone's always like...
The populations that I serve are sorry.
That's okay.
Something got stuck in my throat.
Loved my time at BYU. Hi, it's not you. You're not the problem. I'm the problem.
And I love working with that's it. No, I don't know. Oh, that one is a hard one.
We're good to go. We're recording.
That's cool.
The diffused light and looks
Use
beautiful.
that light.
Good. So,
Eating disorders, trauma, something else I treat. ADHD,
No, you're
psychosis,
That's my character.
depression, family, couples therapy.
Too fast?
oh, that was good. Do you want to do it again?
No.
Okay.
Do you want me to do it again? Because I will.
Why do you like treating OCD?
I like treating OCD because
That's okay. Maybe we can add bloopers at the end to make it 15 minutes long because I don't know how I'm gonna make
oh, what's the word? There's a word I'm trying to think of. It
specialized.
specialized, fluctuating. So OCD just has there's so many different kinds of concerns. You really have no idea where you're going to get. It's just fun to see.
I mean,
Okay.
which is
yes.
totally fine.
Yes, I
But
get it. I get
but
it.
just in,
I am a BYU graduate, and I really loved. Oh, I messed that up.
that's okay.
I'm a BYU graduate.
Perfect. All right. Anything else you'd like to add for the interns?
No. We're good.
Okay.
We're good to go.
We're done.